the staff, was very complimentary of the management, wasn't blaming any individual at all, whether they be political or people who work in the hospital. He was simply pointing out that we need to treat people with dignity, we need to treat people with respect, and hospitals should have the capacity that they need. So he was pointing this out because he doesn't want other people to go through the trauma of what he went through and his wife went through when, after building himself up emotionally and psychologically and physically, and then going home and feeling, in his words, deflated because of what happened, he now has to go through all of those feelings again whenever his appointment is rescheduled. We all accept, Minister, that these things can happen in hospitals, and there is never a certainty when you're scheduled for any surgery. But I think we'd also all accept that if someone is a cancer patient, they should be prioritised. If somebody is going through that trauma and all of that involves with that illness, they should be prioritised. And if this is happening on a more frequent basis, it's a systemic problem, and it's a systemic problem that needs to be sorted. And you know, Minister, I've spoken to you several times about the wonderful staff at the hospital, and I've also spoken to you several times about the lack of capacity right across our health services, and you're aware of the need for additional cardiac services, additional neurological services, high wait times for ENT and ophthalmology, and all those issues that need to be sorted out. But when it gets to a point that you don't have enough critical beds to make sure that older people who have cancer and people who need surgeries when they need them are not getting them, I think that that's a poor state of affair, and that's not down to the wonderful staff at the hospital, that's down to capacity. So I'm asking you to raise this directly with the Minister for Health, and if you can correspond with me in terms of when those patients who are told to go home will have their appointments rescheduled. They should be notified very quickly, they should be prioritised, and if the additional capacity will be put into the hospital to make sure that the level of reoccurrence in terms of this issue will not be happening into the future.
Alaska and Cora, first of all, I want to thank Deputy David Cullinane for raising this very important issue and for giving me the opportunity to provide an update to the House on the recent cancellation of surgical procedures at University Hospital Waterford. By way of context, it is of note that UHW is experiencing ongoing growth and demand for unscheduled care. ED attendances over the past 4 years have increased by 11%. The HSE has advised me that as at 7 a.m. on Friday the 14th of June last, there were 31 admitted patients in the emergency department and 8 extra patients on trolleys at ward level at the hospital. The HSE has further advised that the demand for critical care beds has already exceeded what was available on that day, and that therefore there was no critical care capacity available or likely to be available for patients that would require post-operative specialist critical care that day. As a result, and in line with the hospital's escalation policy, the HSE has advised that 4 scheduled surgeries were actually cancelled. The HSE has further advised that the patients will be contacted urgently to reschedule their appointments. It is important to know, Alaska and Corla, to note that maintaining scheduled care access for all patients is a key priority for hospitals. I fully acknowledge the distress and the inconvenience for patients and their families where elective procedures are cancelled, particularly for clinical urgent procedures. Furthermore, any decision to delay admission or treatment is not taken lightly, and where such decisions are made, they are done to ensure a safe environment with safe delivery of care to all patients as the priority at all times. Last in addition, the Deputy will be aware that increasing capacity across all of our hospitals is a priority for our Government. An additional 241 acute hospital beds opened under the Winter Initiative 2017 and 18, including 18 additional acute beds in Waterford University Hospital. Furthermore, the National Service Plan for 2019 provides for a comprehensive capacity programme, and as part of that programme, an additional 6 acute beds have opened this year in UHW under the 2018-19 Winter Plan. The 2019 capacity programme also provides for 202 additional beds, including 24 beds in UHW during 2019, with a view of bringing this extra capacity into operation in Q1 of 2020. Finally, can I say, Alaska and Corla, my department is also working to improve the access for patients waiting for hospital operations and procedures. Budget 2019 announced that the Government had a further increased investment in tackling waiting lists, with further funding to the NTPF increasing to £75 million. The Joint Department of Health HSE NTF Scheduled Care Access Plan for 2019 was published on the 11th of March. The NTPF are collaborating with the University Hospital Waterford, and to date this year, initiatives have been put in place to arrange treatment for over 3,000 patients across inpatient, day case and outpatient waiting lists. Thank you, Alaskan Corda.
There's one thing in your reply, Minister, that I want to first of all acknowledge, and I fully accept this, where you say that any decision to allay admission or treatment is not taken lightly. And I would fully accept that hospital management don't take those decisions lightly, because they recognise, as you did in the response, that there is an additional trauma to patients who are already traumatised, I would imagine, because of the type of surgery that they are in line for. It also says that these decisions are made to ensure a safe environment with safe delivery of care for all patients. Again, I have no quarrel with that, because if it is the case that the critical beds are taken up and that there is a higher demand than there is capacity, then obviously hospital management and the staff have to make decisions, and decisions they probably don't want to make, but they're forced into making those decisions. But my point is, and it wasn't addressed in the response, and I'm asking that you take this up with the Minister for Health, that there is a shortage of critical care beds. And this will happen over and over again unless we put more critical care beds into University Hospital Waterford. Your statement acknowledges that there is massive increased demand by 11%, because it's a university regional hospital. It services the South East. And if the population grows, then the demand will increase, and that means the capacity has to increase, and that means more critical beds are needed. So I'm accepting that hospital management have a difficult job. I'm accepting that they have to make these decisions. I have no quarrel with them whatsoever. And as I said, the staff were very, very pleasant, and I have to say were excellent to the patients that had to be sent home. They were very conscious of the trauma that they were going through, to their credit. But I have to press you again on this, Minister. We need more critical beds in the hospital in Waterford, and I hope that you will take that directly to the Minister for Health.
Yes, absolutely. First of all, again, let me say that I acknowledge the stress caused to patients, and of course the issue of critical beds. I think that's an essential issue, and that's something that I will bring back to Minister Simon Harris, because we have to see and ensure that these cancellation issues and postponement of planned procedures are dealt with in a proper professional way. So that's something that I will bring back to Minister Simon Harris. But can I also say, Alaskan Cora, while every effort is made to avoid cancellation or postponement of planned procedures, the HSE has advised that planned procedures and operations can be postponed or cancelled for a variety of reasons, including the capacity issues which you mentioned, due to increased unscheduled care demand, which is what occurred in University Hospital last Friday. The South West Hospital Group is committed to the ongoing development of services at the University Hospital in Waterford. And finally, the hospital group aims to ensure that the experience of patients attending the hospital is of the highest standard, and continues to work closely with the hospital management team and community and primary care partners as part of the integrated care model to realise this. But of course, the issues you raised in the debate today, I will bring them back to Minister Simon Harris. Thank you, Alaskan Cora.
The third topical, Deputy Niamh Smith.